Welcome to the Shift Report, the podcast from MCentric and the MCentric Foundation. MCentric is the go-to information and resources hub designed exclusively for the emergency medicine community. We regularly host key leaders from the field who share their insights and experience. Our goal is to inform our listeners and to encourage you to use what you learn to improve your practice and improve yourself. To learn more, please visit us at mcentric.org. Today's episode is sponsored by Lotus Clinician Wellbeing. Lotus Clinician Wellbeing provides consulting services designed to prioritize clinician wellness in order to provide the best care for their patients. Lotus Clinician Wellbeing supports healthcare professionals with personalized coaching and consulting services for groups and individuals in areas such as career development, leadership, burnout prevention, practice management, and more. For more information, visit lotusclinicianwellbeing.com. Today, we welcome Dr. Leon Adelman. Dr. Adelman lives and works in Raleigh, North Carolina. He received his medical degree from the University of North Carolina and trained in emergency medicine at Harvard. He has a diverse set of interests centered around empowering emergency physicians. Today, he joins us to discuss his innovative work at Ivy Clinicians, focused on making emergency medicine job searches less of a mystery, which they are to many now, and he's working to solve that. Welcome, Leon.
Well, Till, it's a real honor. I've been watching your innovative work over the last I don't want to say exactly how many years, but many years. And it's great to be talking with you and talking with somebody who's really a leader in emergency medicine innovation.
Thanks for that. And we've got a team at MCentric who are working on a number of areas and look forward to speaking with you later about other things you're working on. But thanks for taking the time to share a bit of your thoughts on your innovative startup today. So I always ask people, particularly emergency physicians, kind of how'd you get to where you are and what drove you to emergency medicine and kind of what were your initial moves clinically, professionally, and otherwise?
Yeah, good question. So I was listening to some of your previous podcasts, and most of the emergency physicians out there either were like lifeguards or EMTs and doing all this stuff that drove them to be emergency physicians. I was the opposite. I went through med school. I really liked the physiology and learning about everything. And then when I rotated, there were certain things I liked about every rotation and certain things I didn't like about every rotation. And I got to the end of third year and I was like, I went to my mentor and advisor. I was like, I have no idea. I have no idea what I have no idea what to do. And I was even considering taking a year off. And they said, well, there's a spot open at the Carolinas Medical Center Emergency Department in Charlotte, which is one of the best emergency medicine programs in the country. Since you like a little bit of everything, why don't you give that a try? I was like, okay. So 3 days later, I show up in Charlotte, and the doctors at Carolinas Medical Center in the emergency department were just such amazing people doing amazing things that I wanted someday to be like them. And it was the first time in any rotation that I felt like looking at these folks as like, I'm not sure I can get there, but I want to be just like these people.
Yeah, and they're a great group. We know many of the names are well known. Some are sort of more locally known, but a group that many of us have run across and frankly learned from over the years. And names on textbooks and names in government positions and names in leadership in emergency medicine. And so those are a great set of mentors. You are quite well known within emergency medicine, and as I mentioned, focused on empowering emergency physicians, which I think is an accurate statement. I didn't pull that from your LinkedIn profile or anything. I just looked at what you've done and said that looks like it. One thing that many people, I think, will resonate with many, it certainly resonated with me, is your work related to the job search. I recall being told as a young emergency physician, the best jobs are the ones that aren't advertised, which I was told directly that. And then somebody said, let me, call somebody at so-and-so place. I think they have a spot that was not being advertised anywhere. And I recall interviewing there. I didn't go there to work, but that was the kind of the way it worked. And I think has continued to be the way it works for many who are finishing training or even after training, they want to move to somewhere either for professional or family or other reasons. You're working at IV clinicians to solve that. How did you sort of develop that interest and how did you start to build that?
Yeah, good question. So the problem that we're solving for with Ivy clinicians has a few kind of origin stories. One is that this is one of these things where me and my friends have said over and over again, this thing should exist. So when I moved from Boston to the Washington, D.C. area, what I was looking for online was a resource where I could see, okay, I'm going to be living in Washington, D.C. I'm willing to drive 30 minutes. What are my employment options? And I'd like some information about each of those options so that I can decide which ones to apply to and then have the basic information to apply. There was nothing like that 10 years ago when I moved from Boston to DC. And then I moved to Nashville, still nothing, no resource like that. And then when I was a medical director recruiting to rural emergency departments, I faced the same problem just on the other side, which is what I was looking for was one place where emergency physicians, when they looked for jobs, they would congregate. And if I provided them, good enough working conditions, pay well enough, have what those doctors are looking for, I can get in front of them. And there wasn't really a resource like that. The doctors that I was looking for weren't really on job boards. And so what ends up happening on the employer side, what is just that we spent a ton of money on recruiters to go to lots of meetings and lots of events, and it was really expensive and really slow. And it seemed like these two problems need to be solved together to create a resource for emergency physicians to easily navigate the job market, a Zillow type experience, but also have it be such a centralizing force for the community that if you're a recruiter or a medical director, you can put yourself into this community and connect with emergency physicians who would be interested in you, which would save you time and money. But then there's kind of the second level, which is that emergency medicine over the last 20 years or so has moved from a group of practices, so partnerships or academic practices, where really the goal is to find one and then hold on forever, right? So if you're at the old emergency medicine associates in Northern Virginia, like leaving that practice would have made no sense whatsoever. And you wanted to be insular. You didn't want to be adding people all the time and having people come and go. You wanted to have a practice, right? And so you didn't really need much technology for that dynamic to work. Um, but that those days are gone, right? Or for the large majority of emergency physicians, that's not the practice type that we work in. We are employees. Emergency physicians are employed, right? And as employees, the for better or for worse, the way to make sure that the employer is giving you the right salary, is taking care of its employees, is to be on the job market. So if you look at the most satisfied set of employees in the United States, it's software developers. Well, the average tenure for a software developer at a company is 2.5 to 3 years,
Mhm.
right? Those things are totally connected to each other. So because companies know that if they don't treat their employees well, the software companies know that they'll leave immediately because they're willing to change jobs. Well, now there's a liquid, transparent job market, and so the employers treat their employees really well. So the two things that Ivy was trying to address, one was transparency and creating a job market that worked for both sides without wasting time and money. but also create a job market that incentivized really good treatment of physicians, PAs, and nurse practitioners in emergency medicine.
So that's a great story. And I guess the overly simplistic analysis of this would be something like, well, that sounds great. You're solving a problem. Just create a website where people can go in and kind of talk to each other, and that'll fix it. I know it's a lot more complex than that, related to how do you do that? How do you get the information? How do you get the money for it? So let's dig a little bit into taking an idea that everybody agrees is solving a problem that truly exists to the reality of a functioning system that is sustainable.
Yeah, it is really hard to start a business. I can tell, war stories from here until till late night in the evening, but um, yeah, happy to dig in a little bit. So the hardest part with creating a marketplace is that what we're selling really isn't a service or a product. We're selling connections to the other side of the market. To the physician, we're selling connections to the employers. To the employers, we're selling the connections to the clinicians. Well, when you start, you have neither, right? And
Right.
so somehow you need to build up enough volume of use on at least one side of the market to start bringing in people from the other side of the market. The technical term for this is the cold start problem. So how did Ivy go about this? Well, we kind of hacked one side of the market. So what we did was map all of emergency medicine. And what I mean by that is there are about 6,000 emergency departments in the United States largely through brute force and lots of Googling and other such
Hmm.
low-tech ways. We connected all 6,000 emergency departments to their emergency medicine group. But then, really importantly, we connected the group to the in-house recruiter and the in-house recruiter's email address. And so over years of kind of building up this data set, what that allowed us to do is to the emergency physician, it looks like all the recruiters are already there, but the
Mhm.
recruiters don't know that they're there, right? Their email address is there, but they wouldn't necessarily know that Ivy exists or that they exist on Ivy, and they hadn't signed up for anything. And so the first time that most recruiters hear about Ivy, it's through an application that goes directly into their inbox from a legit emergency physician. Well, if you're getting paid to recruit and hire emergency physicians, getting a free application in your inbox is like, it's manna, right?
Right.
This is like amazing stuff. And so then it becomes much easier to actually bring them in, and then they add their data and they build a much more useful ecosystem, and that's how we have started to ladder up the amount of usage. Then there's the next part, which is, okay, once you get started with the laddering up, how do you get um, enough physicians so that somebody on the recruiter side would be willing to actually pay, you know, actual physical dollars for this these connections. And so the answer there is really hard when you don't have money, right? You don't have, since the recruiters aren't yet willing to pay, we don't have a revenue stream. And so what we've had to do is basically create our own marketing. Um, and you have had some really good conversations in the past about marketing in emergency medicine and physician marketing in general. But a lot of that marketing really has to be genuine. Emergency physicians and physicians in general don't generally want to be like advertised to. They want to be educated, they want to
Right.
learn, they want to interact with each other. They want genuine stuff. And so what we've done is created genuine educational products. That's where the emergency medicine workforce newsletter comes in. That's where being on podcasts and posting on LinkedIn comes in. And so the word started getting out in emergency medicine about the stuff that we're working on, and then it's word of mouth, right? Then you actually have to have a product that physicians, especially resident physicians, say, "Oh wow, this is like so much better than my other resources out there," and then they tell each other. And that's basically the steps that we have taken to build Ivy.
So that's a great story. Lots of lessons in there about how one builds a business out of an idea.
Right.
So where are you now in this? So if I'm a resident and I want to, and I'm looking for jobs, how does it work?
Yeah, so the simplest way to think of it is like a Zillow type experience. So when I was searching for jobs here in Raleigh, North Carolina, I started with a geographic, my job search was geographic, but then I had, certain things I was looking for. Well, that's the setup within Ivy. So you search by geography, whether it's city or state, and then on the right side there's map, on the left side there are thumbnails. You will find it very consistent with VRBO, Airbnb, Zillow. Instead of filtering by bedrooms and bathrooms, you're filtering by whether it's critical access or their residents or volume, stuff that you would care about. Um, and then what also we wanted to make sure was that the user experience for the physician is as seamless as possible. So one of the things that makes me want to throw my computer at the wall is when during credentialing, somebody asks, where did I go to medical school? Can you write out your med school? Well, if you Google my name, like you can figure that out. Why am I saying
Mhm.
that, right? So we subscribe to the Federation of State Medical Boards. So all you do is you put in your information, you match up the NPI. We actually have like an auto-complete. And so all of your credentialing information is already there. All you have to do when you send an application is add your CV, because recruiters like love the CV. That's kind of their little gold nugget that they're
Mhm.
trying to get. So you add your CV, and that's your application.
That's great. And so, we see this will not eliminate the classified advertising and recruiting tables at conferences and the like, but it certainly may well change how the industry spends money and spends resources on getting physicians. And I say physicians, does this also apply to other clinicians, NPs and PAs right now, or is it just physicians?
Yeah, so it's physicians, PAs, and nurse practitioners. So basically any employee of the medical group, rather than so not nurses, not techs, the
Right.
medical group side.
Yeah. So I can I'll ask you, I'm presume I'm correct that one can anticipate that in maybe in a few years there'll be some changes in the way the landscape looks because perhaps employers will realize they don't have to spend the money they spend on flashy ads and things in journals and tables at conferences and otherwise that they can more automate this like Zillow has automated looking for a house. Am I correct?
So yes, though I've been fascinated by how kind of things are the way they are for a good reason most of the time, or at least a internally consistent reason. So when we started, part of what we thought we would be doing is killing off locums. Why do you need locums if you have a transparent marketplace where you can, if a place has a hard time hiring, they would just sort of raise the pay or do whatever it took to find, the sales point at which you can hire enough ER doctors to fill your shifts. Well, it turns out that that's not how most emergency medicine groups think. They they don't want to raise internal prices or internal compensation any more than their internal limit. And so they're willing to go outside of their company to pay a lot more for temporary labor in order to keep down the internal compensation, right? Because they, in a lot of times, and this is like an accurate accounting, they do think that if they had to raise pay for everybody, that's more expensive than just getting a few really expensive temporary workers. Well, they also need plausible deniability, right? So if you're a large company, we'll use American Physician Partners as the example because they don't exist anymore. So if you're APP back in the day, you don't want there to be ads out there saying APP hiring for $400 an hour, temporary labor, locums APP, right? Because then a CEO will see it, or your competitor will see it, and
Mhm.
they'll send it to the CEO and be like, "What in the world? APP is hiring people for $400? Like they're wasting your money, and they're bringing in temporary labor. We can do this so much better." And so what these locums companies do is give the primary employer plausible deniability that it's like, oh no, we don't pay $400 here. We pay $200 an hour or whatever it is. And so the locums business is not easily disruptible through just transparency and a liquid marketplace. And we are actually, so Ivy Clinicians will be launching our kind of locums marketplace over the next few months because we've realized like if you can't beat them, join them, right? Like they don't, neither side of this market wants to be disrupted or made to go away. So if Ivy Clinicians is the place to find all the jobs, well, locums are real jobs. They're very good jobs for people who want to do locums. So we are going to create a vertical within Ivy Clinicians that offers locum jobs.
Thank you for that. I was going to ask you about the locums marketplace, which you seems like you're ahead of me because it is an important opportunity for many people, and locums isn't for everybody. For some people, it's their perfect work situation and can be quite lucrative, but also can be flexible and seems to work for a lot of people. And there's certainly a group of companies that are in that marketplace. They all have pluses and minuses and things that set them apart, and they're in business competing with each other. I probably get some of the same. You and I get the same emails and the same calls from various of them at times because of our licensure and our names being out there. They're very good at trying to find people. So you're going to be, sounds like Ivy Clinicians will also be a source for physicians who are looking for information about that work opportunity.
Yeah, so it fits within our mission to organize and make it simple to navigate the job market. We want to make sure that if an emergency physician is looking for permanent jobs, they can find all the information. If they're looking for travel jobs inside of a company like USQ Care Solutions, they can find that. If they are looking for totally temporary jobs that are just trying to max out their pay and they're willing to fly anywhere, we want to offer the best of that as well.
And not to ask you to give up proprietary information about what your next couple of years looks like, but presumably, emergency physicians are not the only employed physicians in the country. I can imagine other markets where the same methodology could work for other specialties. And I presume that that thought has crossed your mind and probably has crossed the mind of funders who may want to help you grow. I assume that's a fair assumption.
Yes. So when we started Ivy Clinician, so we incorporated August 3rd, 2021. When we started, we thought we would get to hospitalists and specialties like critical care, radiology, any of these employed or heavily employed specialties that have a little bit more ability to change jobs because they don't have their own long-term relationships with their patients. We thought we would get there within a year. What we've found is that building a marketplace within emergency medicine requires so much work, and we keep digging deeper and deeper within emergency medicine that 3 years on, we're still building the community within emergency medicine, and it's still the right thing to do because that is really until we are what we said we set out to be. So the place where you find jobs in emergency medicine, we have not reached our real endpoint in emergency medicine. Hopefully over the next over the next year, we'll get into hospitals medicine, which was our plan from the beginning. But really what we're focused on is being the best possible resource in emergency medicine. The best counterpart to us in another specialty is a website, a company called Gaswork. So if anybody has friends or colleagues in anesthesia or CRNAs, it is extraordinarily likely that they got their job or information about their job through Gaswork. Well, if you Google Gaswork, go to gaswork.com, it looks terrible. It looks like it was built in the 90s because it was built in the 90s, 1996. It's not obvious that anything has changed since 1996, but you know what? It is the place where anesthesiologists go to look for jobs. And so it's the place where anesthesia companies post their jobs, and it is just where anesthesia lives. And so our goal is to provide such a great product for emergency medicine that Ivy is where emergency medicine physicians look for jobs and employers look for them.
That's great, and this is a great discussion. I think it's Ivy Clinicians is certainly a needed resource. That's, it's one of those things where as you hear more about it, you think, why wasn't somebody doing this 15 years ago? But they weren't, and so thank you for doing that. We can't have this sort of discussion about jobs and job search, the workplace landscape, without talking a little bit about burnout. And I'll just ask you a little bit about your perspectives. That's sort of another long discussion for another day, but we now have residents who perhaps while they're looking for jobs are thinking of what their exit strategy is while
Mhm.
they're residents. They don't even plan to work for very long. And then there's an entire sub-industry of people looking for non-clinical things to do, which are not necessarily a bad thing, but do speak to the trouble that medicine may be in or emergency medicine may be in from a workforce standpoint. What have you learned about that from your perspective, and what are your thoughts on how Ivy clinicians may be helping that?
Yeah, it's such an important question. I think whenever we talk about burnout, I think it's important to clarify what we're talking about. We're not talking about weak humans who succumb to their weakness from a lack of yoga and uncenteredness and something that is individual to that person, right? These are people who went through med school, they went through residency, they worked, 80, 100 hour a week job, making $12 an hour, going to work feeling, like they were just trying not to kill patients, and left work frustrated because they didn't know nearly as much as they should have. Like residency is really hard, right? To be burnt out when you're making plenty of money and you're working, 14 days a month and you actually know what you're doing, something's wrong with the job, right? Something is wrong with the job if people who've been through residency feel like they are burnt out doing something after residency. Well, what's wrong with the job? Well, part of it is emergency medicine is inherently difficult, right? That's part of why most of us went into emergency medicine. We didn't want to do the easy stuff. We wanted to do the hard stuff. And in order to make a difficult job meaningful, there are certain things that have to go along with that. You have to have real autonomy. And what I mean by that is you as the physician need to feel like if there is something that needs to be improved to deliver better care, that you have the ability to make those improvements so that patients will continually get better and better care, and you're part of that solution. You need gratitude in terms of both management that really is there for you whenever things do get hard, but also gratitude in terms of money, right? So physicians need to get paid commensurate with the work that they put in to get to that point. And there also needs to be a real connection between excellence and work put in and something later on in the career, right? So whether it's rising up within an organization or equity or something so that you feel like, okay, when I'm here in 5 years, things are going to be better because I'm working hard and I'm doing great and I'm going to be rewarded for being great. Well, if you take all of those things away, you have boarding, so you can't possibly take good care of these patients because they're in the waiting room. And you're the ER doctor, and somehow you're supposed to like take a double sign out septic patient who you don't know anything about, and now all of a sudden you're like the critical care doctor, but there's no critical care nurse, and all of a sudden the patient codes, and you're like, this is the stupidest job ever, right? There's no way that I can take good care of that double sign out patient who has no nurse and just coded. And this is not only bad care, it is really dangerous for me because you know what? I could get sued for that double sign out patient who had
Hmm.
no nurse and then just coded that I had no chance whatsoever of taking good care. Okay, so there's the quality of care. There's also the like, okay, this group of people no longer owns their practice, and so I don't really know how to even, or I don't even have the power to change any of this. Like, I want more nurses. We're not going to be more nurses. I want more doctors. We're not going to be more doctors. I want PAs to be trained to a certain level. That's not going to happen. You start getting really, really frustrated, and then the finances. Well, you don't see the finances anymore, right? So most emergency physicians don't get to see where the money is going. They know that there's money coming in, but somehow they haven't gotten a raise in 5 years. Well, that's not commensurate with the amount of work that you put in to get to this position, the amount of risk that you're taking care of these patients, the difficulty of the job itself, physically, mentally, emotionally, and you're like, I am gonna get a desk job, right? So how does one turn this ship around? I think we can talk in a lot more detail in the future, but really it's about kind of first principles, like thinking, okay, if you are a patient, how do you want your doctor group to look? If you're a doctor, how do you want your physician practice to look? And how do we make that financially viable and competitive, rather than starting with how do we maximize our individual doctors' money by setting up something that can be sold to a banker someday?
That's great insights, and we look forward to working with you and other leaders in the field from our perspective at mcentric.org to really focus on wellness and burnout, and probably at first define it a bit better to make sure we know what problem we're solving, and then try to provide some solutions. So thank you for that, and thanks for your time. Remind us again how to find you and IV clinicians, and where someone should go to learn more about you.
Yeah, so I'm on all the socials. So Leon Adelman, Adelman. IV Clinicians, you can either Google it or it's ivclinicians.io. And I put out the emergency medicine workforce newsletter about the business of emergency medicine from the perspective of the clinical emergency physician, and that's Googleable, emergency medicine workforce newsletter.
Thanks very much, and thank you for joining us today and sharing your perspectives. And we'll look forward to welcoming you back in the very near future.
It's my pleasure.
And thank you for joining us in this installment of our M-Centric podcast series, The Shift Report. And special thanks to Dr. Leon Adelman for sharing his important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.org. And another thank you to our sponsor, Lotus Clinician Wellbeing. Learn more at lotusclinicianwellbeing.com.